does chemo work? So I have a couple pictures I can show you of some of the things that happened to me. I'm a professional journalist, so it's easy for me to record myself like this, and it's also easy for me to take photographs of myself. You know, it's funny, I wanted my husband to help me out a little bit and shoot one or two here and there, but it was hard for him, and he had this weird feeling that I was trying to document my death or something, which wasn't really true at all. I guess it's just one of those things that journalists do. We just think about recording things. I don't know if it's just for me. It's probably just for me. Heck, talking to you right now is probably just for me, a little bit of therapy, but I sort of pretend to myself that if I tell people this story or I show people a story that maybe somehow it will help them along. So it was a little difficult for me to shoot photographs of myself. I mean, you're doing this selfie kind of thing a lot of times, and so that's a little weird or a little awkward, but you know, I did manage to take a few photographs, and so I have some of those to share here, and hopefully some of them will help you and help make it a little bit easier for you to see the kind of things that happen when you're going through something like this. Once again, this is my experience. It's probably not the same experience that other people have. It's probably not going to be the same experience that you have, but it can sort of give you an idea of how things might go. So chemo, the first thing you need to know about chemo is that I highly recommend that you get a port. A port is a little device that they put in you have to be in surgery, you know, they put it under your skin, in your chest wall. It has a tube that leads up into your jugular, and it's all underneath there, and it's sort of got a soft spot on it for the needle to go into. And so basically they can just poke this spot on your chest with the needle and give you the chemo drugs. It's weird at first. For a week or so it's kind of awkward and everything, but after that you get very used to it. I played softball with it. I did a lot of activities with it. I got very used to it. It didn't bother me at all. And it saved my veins, I'm sure. I know people, you know, back in the day when the only way they had to give you chemo was through your veins. I think basically it can damage them severely. And if, God forbid, you ever need to use those veins for something, you're not going to want them damaged. And so port is a really useful, great technology that they've invented that makes it a little bit easier on you. Basically, once you have the port placed, before you go to a chemo treatment, you'll put some lidocaine on the port and then cover it with a piece of plastic. I had some neat little plastic bandages they gave me, but also you can use saran wrap, you know, just to keep it on there for about an hour. And that numbs that area of your skin so that it won't hurt when they stick the little needle in there. Just one other thought, the other reason why you want to be sure your veins are clear is because once you've had the sentinel node biopsy, it's also not recommended for you to have blood pressure taken or your veins accessed on that side. And so now you literally have just one side to work with already, so you're already limiting yourself. And so, you know, it's a really great idea to get a port. So once you have the port, you go in, and I'll just kind of tell you a little bit about my first time. You know, you have all your hair still, you have all your positive attitude, and you're going to go in there and kick this thing's ass. I mean, let's face it, that's what we all want to think and be. It's a little scary, and you're just trying to, a lot of times, I mean, for myself, I was just trying to, you know, psych myself up and give myself positive thoughts and just get in there and get it done. So I went in. The infusion room is full of these sort of recliner chairs. They try to make it comfortable because you do have to stay there a while. Depends on what kind of chemo you're getting, but many kinds of chemo are administered over an hour, 2, 3, 4 hours on drips. And so, you know, you want to be comfortable. There's usually something to watch, TVs. There's always books to read. You know, it's great if you want to bring someone. I think every chair has another chair next to it, so you can bring somebody to visit with if you like. The first time my husband came, and you know, it gets back to that thing about, you know, being married or your loved ones being worried about you. I felt personally like he was very nervous and upset about it, and you know, and I wasn't really very happy about it myself. So it was sort of a scary moment, you know, and he was there for me and he hung out with me, and I thought that was terrific, and I appreciated it so a lot, you know, like all of us do for our loved ones. So he came along, which was great. But after that, I didn't want him to come along. I would rather do this alone. I didn't really I just didn't want to see him upset. Once again, I think that gets back to all of us trying to protect each other. But the first time we went together. He sat next to me. We sat down. I was all ready. The nurse came up. I have to say, they do a really great job. The nurses that work in the chemo infusion centers, they know that you're scared, and they know that you don't know what's going to happen, and and they want to make it easier on you. And so I had a nurse named Paula, and she's a great lady. I still see her when I go by that office sometimes, and I appreciate everything she did that day. And basically, she explains everything in detail. Here, I'm going to do this. I'm going to do that. Initially they'll put this needle in. So basically, they open up the clean, sterile needles and tubes and things that they need. It's sort of a squarish thing with a needle sticking out of it. They remove the plastic over your port and wipe that down, and then they basically go straight in. And I got some photographs of that I'm going to show you right here. And they go straight in with that. And it's got the tube coming out of the needle, and then they hook that up to an IV, and there's a lot of tubing, and there's some different areas that you can access the tube from. And they're all used for different things, I'm sure. But the first thing they do is they hook you up to that, and then they run those lines through this little machine that sits next to you, and the machine has, some buttons, et cetera, et cetera. And basically, it controls the speed of the drip. And so different chemos have to be administered at different rates. And so, they're all very knowledgeable about what you need. And so they hook you up and they get you some saline solution going, to get all your veins open up and make sure you're hydrated well. And then they start bringing you the pre-meds. So each time they bring you a medicine, they bring it over to you, and it's been mixed by the pharmacist right there. At least in my case, it was mixed by the pharmacist right there in the infusion center. And it's got your name on it and your date of birth, and you have to check it. And I mean, there's all these fail-safes to make sure you're getting the medicine that you've been prescribed, and that there's nothing wrong, or mistakes don't happen. So you read it and you look at it and you say, okay, this is me, this is my medicine, and they start giving you these steroids and anti-nausea drugs. Sometimes they're giving you Benadryl. It's all intended to keep you from having allergic reactions and to keep you from getting sick right there, and to make the medicine go in a little bit better. Then the pre-meds, depending on what you're getting, usually took about a half an hour, I'd say, between waiting for the nurse to get back to you when one ends, and and between the time it takes for them to drip, etc. And each nurse usually had a pod of 4 chairs, and so there were often 4 people there. Sometimes there was only 1 or 2, and they stagger the whole thing so people are coming in and out at all times. They give you those pre-meds, and then because you're connected through the port, which once again, this is so fantastic about the port, because you're connected through the port, they're not poking you and unpoking you, etc. They're just using this tubing to inject the new drugs or to switch out the different medications. Now the adriamycin, that's the big red devil that women talk about. It's pretty caustic. In fact, before I could take adriamycin, I had to go and have a couple of tests done in advance. One of the things that everyone has to do after they get a cancer diagnosis is check and make sure that's the only place the cancer is. And so, you have to go and have CAT scans done or bone scans, etc. And I had all those things done. But before the before the adriamycin, I had to have a MUGA scan, which is basically a sort of a heart scan. Some doctors prescribe echocardiograms, I think, but whatever it is, normally you have your heart checked. They want to make sure that your heart can handle this drug. That's the kind of toxicity that this particular drug has. So the adriamycin, though, comes in these big tubes. It's just this red, yucky medicine, and they administer it. So the nurse has to physically sit next to you, and it probably takes 10 minutes. There's probably like 3 tubes. They're quite big, and she just sits there and talks to you while she's basically pressing in the tube at a slow rate and administering that drug. After the adriamycin, then the Cytoxin was given through a drip, a normal IV-looking thing. It was hung on the pole, and it dripped, and it went through the machine at the rate that it was supposed to go through. The whole AC part of it would take maybe 3 hours, I think, 3 or 4 hours. So you were there for a little bit, and the pole is on wheels. The little machine is on wheels, and so it runs on a battery, so you can plug it out of the wall if you need to go to the little girl's room or a little boy's room or whatever, and you can wheel it along with your IV attached to you and use the facilities. You can get up and get some soda. You can make some popcorn or whatever you need to do. Change the channel. So it's all set up to try to make you comfortable and not make you feel like you're stuck in a hospital bed for 4 hours and have to use a bedpan or something. I mean, it's, very civilized. You don't have to get in and out of your clothes or do anything like that. You're just sitting in a room with people and visiting. And lots and lots of people do it exactly like that. They visit, or they bring a friend, or they knit or something, and they just try to pass the time.